everyone. My name is Becky, and I will be going over panic disorder. Panic disorder is a recurrent attack of overwhelming anxiety that usually occurs suddenly and unexpectedly. The reason why I chose this topic is because I suffer from panic attacks frequently, and I'm hoping to get a better understanding of what treatment would be best so that I do not have such severe panic attacks. How do panic symptoms develop? A phobia of internal sensations is thought to drive the patient's avoidance behavior. In addition to neurochemical and genetic models for this disorder, some researchers have proposed a cognitive model in which patients learn to misinterpret thoughts and emotions as physical symptoms. For example, a woman is afraid of being left alone when her husband leaves for work, may experience the fear psychologically, shortness of breath, sweating, which in turn makes her feel more anxious, like, what's wrong with me? Deepening the spiral and leading to more symptoms. Another theory is that patients escalate otherwise benign body sensations into panic attacks. For example, a man whose heart rate accelerates when he becomes angry may escalate that sensation and the resulting anxiety into the chest pain of a heart attack. Both examples demonstrate the patient's phobia of internal sensations. How common are panic disorders? In a given year, the estimated percentage of U.S. adults with panic disorders is between 2 and 3%, and women are more likely than men to experience anxiety disorders. During an attack, several of these symptoms occur in combination: palpitations, pounding heart or rapid heart rate, sweating, trembling or shaking, feeling of shortness of breath or smothering sensations, chest pain, feeling dizzy, lightheaded or faint, feeling of choking, numbness or tingling, chills or hot flashes, nausea or abdominal pains, feeling detached, fearing loss of control, and fear of dying. Because symptoms are so severe, many people who experience a panic attack may believe that they are having a heart attack or other life-threatening illness and may go to the ER. Panic attacks may be expected, such as a response to a feared object or unexpected, apparently occurring for no reason. The mean age for onset of panic disorder is 22 to 23. Panic attacks may occur with other mental disorders such as depression or PTSD. Diagnosis. You want to have a complete physical exam, have blood tests to check your thyroid and other possible conditions, and tests on your heart such as an ECG or EKG. A psychological evaluation to talk about your symptoms, fears, or concerns, stressful situations, relationship problems, situations you may be avoiding, and family history. You may also fill out a psychological self-assessment or questionnaire. You also may be asked about drugs, alcohol, or other substance abuse. The criteria for diagnosis of panic disorder. Not everyone who has panic attacks has panic disorder. For diagnosis of panic disorder, the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, lists these points. You have frequent, unexpected panic attacks. At least one of your attacks has been followed by 1 month or more of ongoing worry about having another attack. Continued fear of the consequences of an attack, such as losing control, having a heart attack, or going crazy. Or significant changes in your behavior, such as avoiding situations that you think may trigger a panic attack. Your panic attacks aren't caused by drugs or other substance use, a medical condition condition or another medical condition, such as social phobia or obsessive compulsive disorder. If you have panic attacks, but not a diagnosed panic disorder, you can still benefit from treatment. If panic attacks aren't treated, they can get worse and develop into panic disorder or phobias. Treatment can help reduce the intensity and frequency of your panic attacks and improve your function in daily life. The main treatment options are psychotherapy, medications, and cognitive behavior therapy. One or all types of treatment may be recommended depending on your preference, your history, the severity of your panic disorder, and whether you have access to therapists who have special training in treating panic disorders. Medications can be used for panic disorder. Medications can help reduce symptoms associated with panic attacks as well as depression if that's an issue for you. Several types of medications have been shown to be effective in managing symptoms of panic attacks, including antidepressants. Medication have been shown to reduce panic severity, eliminate attacks, and improve overall quality of life measures in patients with panic disorder. Benzodiazepines are as effective as antidepressants in reducing panic symptoms as well as frequency of attacks, are well tolerated, and have a short onset of action. However, they may cause depression and are associated with adverse effects during use and after discontinuation of therapy. If one medication doesn't work well for you, your doctor may recommend switching to another or combining certain medications to boost effectiveness. Keep in mind that it can take several weeks after first starting a medication to notice an improvement in symptoms. Types of therapies. Psychiatrists and other mental health professionals use several types of therapy. The choice of therapy type depends on the patient's particular illness and circumstances and his or her preference. Therapists may combine elements from different approaches to best meet the needs of the person receiving the treatment. Cognitive behavior therapy helps people identify and change thinking and behavior patterns that are harmful or ineffective, replacing them with more accurate thoughts and function behaviors. It can help a person focus on current problems and how to solve them. It often involves practicing new skills in the real world. CBT can be helpful in treating a variety of disorders, including depression, anxiety, trauma-related disorders, and eating disorders. For example, CBT can help a person with depression recognize and change negative thought patterns or behaviors that are contributing to the depression. Interpersonal therapy is a short-term form of treatment. It helps patients understand underlying interpersonal issues that are troublesome, like unresolved grief, changes in social or work roles, conflicts with significant others, and problems relating to others. It can help people learn healthy ways to express emotions and ways to improve communication and how they relate to others. It is most often used to treat depression. Dialectical behavior therapy is a specific type of CBT that helps regulate emotions. It is often used to treat people with chronic suicidal thoughts and people with borderline personality disorder, eating disorders, or PTSD. It teaches new skills to help people take personal responsibility to change unhealthy or disruptive behavior. It involves both individual and group therapy. Psychodynamic therapy is based on the idea that behavior and mental well-being are influenced by childhood experiences and inappropriate repetitive thoughts or feelings that are unconscious. A person works with the therapist to improve self-awareness and to change old patterns so he or she can more fully take charge of his or her life. Psychoanalysis is a more intense form of psychodynamic therapy. Sessions are typically conducted 3 or more times a week. Support therapy uses guidance and encouragement to help patients develop their own resources. It helps build self-esteem, reduce anxiety, strengthen coping mechanisms, and improve social and community functioning. Supportive psychotherapy helps patients deal with issues related to their mental health conditions, which in turn affects the rest of their lives. Additional therapies are sometimes used in combination. They could be animal-assisted therapies, working with dogs, horses, or other animals to bring comfort, help with communication, and help cope with trauma. Creative arts therapy, the use of art, dance, drama, music, and poetry therapies. Play therapy is to help children identify and talk about their emotions and feelings. Living with panic disorder, it is important for people struggling with this panic disorder to have natural support in daily life. Connecting with loved ones and letting them know about your condition is important in starting to manage the disorder. Ask loved ones to check in regularly and encourage you to spend more time socializing. Don't be afraid to ask for support. These are my sources that I used: the American Family Physician website, American Psychiatric Association, Mayo Clinic, Healthline, and Cooper Rees Healing Community. I hope this presentation was informative, and have a great day. Thank you.